Hi, I'm Sudha Krishnan. Our healthcare system is complicated and people have a lot of questions, so I want to help you figure out one piece. For decades, the mantra to ease the strain on Quebec's healthcare system has been this.
I don't think we have the leisure to not being able to use private sector at this point because the needs are so big.
There's lack of beds, lack of personnel.
But ERs are still overcrowded and people are still waiting for care. So that got me thinking, is boosting the private system actually hurting or helping the public system? To get some answers, I'm checking in with someone who's been on the front lines. Dr. Aurélie Nguyen-Guyez is a private family doctor who makes house calls. So your car is your office?
Yes, that's right.
Okay, let's check it out. Nguyen-Guyez spent most of her career as a public doctor. She's originally from France, and compared to Quebec, she says there it's easy to see a family doctor.
So they call them and they have an appointment in a few hours.
In a few hours?
Yes.
After 7 years of working in Quebec's public system, she left. Now as a private physician, she feels she's helping people desperate for care.
A simple consultation is $279.
That's a lot of money.
Yes. They can't wait anymore. It's like, okay, so what's my choice? Emergency room or I pay?
The latest data shows a record number of doctors had left the public system. A 22% increase from the year before, and according to the Globe and Mail, more than double the amount from more than a decade ago. Seems like a lot, but let's just pause here for a moment. More than 95% of Quebec's doctors work in the public system, and the province is expecting to train more than 1,100 doctors a year. But when 2/3 of that amount leave the system, that's a challenge. So how did Quebec get here? Go back 20 years to the landmark case Shaoli versus Quebec. In 2005, the Supreme Court of Canada ruled long wait times for medical care violated patients' rights. That opened the door to more private care for non-urgent cases like hip and knee surgeries. More private clinics popped up with publicly paid for services, from ultrasounds to doctor's visits. There are also more clinics catering to people willing to pay out of pocket for faster care. During the pandemic,
c'est l'utilisation des cliniques privées.
The province signed contracts with the private sector to perform day surgeries at no cost to Quebecers to reduce the wait list that exploded during COVID-19. $82 million was allocated. I checked out the Health Ministry dashboard. The number of patients waiting more than a year for orthopedic surgery is steadily dropping. Santé Québec says it's due to hospitals better prioritizing care. But the number of patients waiting for orthopedic surgery shot up by about 7,000 from January of this year compared to about 5 years ago. Santé Québec says that's partly due to a hike in demand. Quebec's population is aging, and even if some of the waitlist pain is passed on to the private clinics, more and more are going to need this kind of care. So it looks like it's working. However, it's not that simple. Surgeries in private clinics are taking patients, but generally they're healthier and need less complicated care, leaving the public system to bear the burden of the more complex cases. So the system is performing more orthopedic surgeries than it did pre-pandemic, but 91% of them are still being done within the overburdened public system.
It's a vicious circle.
I checked in with another family doctor, a defender of the public system.
Every worker working in the private system is one less worker working for the public system. We have a fixed number of workers, of doctors, nurses, respiratory therapists, and when you offer better working conditions, and the public system is now not stuck, but we are dealing with the heavier patients with less manpower.
So why does this seem like more of a Quebec thing? Probably because it is. The latest comparison available shows Quebec had 642 private doctors, the rest of Canada, 18. So why is that? Well, here's how one health economist sees it.
So that the physicians can opt out and charge what they want. Other provinces don't allow that.
Okay, let's just take another pause here. When Medicare was being implemented, many doctors in the 1960s, namely specialists, had resisted. So the government created 3 forms of doctors: public doctors and 2 forms of non-public system doctors. Both bill patients directly, but doctors who opt out still charge based on the public fee structure, and patients can make a claim with RAMQ to be reimbursed. Doctors who are non-participating mean they can charge what they want and RAMQ won't reimburse you. Countries with systems similar to ours, like Australia, have been using the private sector to speed up access. Its success depends on how the privates are regulated.
If the private system gets all the, sort of healthy 70-year-olds who need cataract surgery, but they're paid less for those surgeries than the public hospitals that are providing surgeries on the very much more sick 85-year-old patients, it sort of balances out.
The public-private debate has been on the radar of the Canadian Medical Association, which actually keeps track of how much money is spent in the private system. That system includes doctors, as well as some things like mixed services like ultrasounds and mammograms, as well as services like physiotherapy or anything else you pay out of pocket or through private insurance.
Our private system makes up 30% of our healthcare system, which is quite a bit more than most European countries.
The CMA has been actually talking to Canadians about this, who actually value our public system, but they're open to options so long as they don't have to pay out of pocket.
Those are areas where we could explore if we had enough healthcare providers to provide those services.
There's no one-size-fits-all healthcare funding model. It all comes down to what's more valued. If you're talking about equity, our system prioritizes that. If you're talking about access, mixed systems like Australia's gets you into a doctor's office sooner if you can afford it. The Legault government sees the private sector as a complement to the public system and not a replacement.
I think there is a minimum of private that we should have. At one point, this trend of going from public to private should stop.
Since she's gone private, Nguyen Nguyen says her patients are happy, but
if we can have 100% for the public system, I'm waiting for that.
Diagnosis? Critics see boosting private care in Quebec as a band-aid solution, but it's hard to go back given private options have been a part of our system for so long. But the time to act is now, and finding ways to bring more workers back into the public system is one way to stem the bleeding.